Hi, my name is Dr. McKenzie. I am a chiropractor that specializes in neurology. Today I'm going to talk about panic disorders. So we have special diagnostic criteria to basically determine if somebody has this. So you have to have at least one of the attacks that has been followed by 1 month of 1 to 2 of the following. And so really, if you've had persistent worry about having additional attacks, that qualifies. Or if you have maladaptive change in behavior in order to avoid having panic attacks, that also qualifies. So these, in other words, people that live a life of avoidance so they don't have to have a panic attack, these are the kinds of things that we see. And this is not attributable to substances or medications or any other medical condition. So these are the criteria. Some of the things that we see are trembling or shaking, sweating, increased heart rate, shortness of breath, feeling of being choked, chest pain or discomfort, and also derealization. Derealization meaning that your perception of reality isn't really the amplitude at how you perceive it. So something that is really mild, you perceive it as more than what it actually is. Okay, so the first panic attack is often completely spontaneous. In other words, you're walking around and all of a sudden you just have one. You have no idea what brought it on. These attacks can last 30 to 40 minutes. They can vary in frequency and the severity. And a lot of times patients will end up missing work or school because they're just scared that they're going to have them when they're on the job or when they're around their peers or whatever. So it really can create some issues socially. Some other things that we oftentimes see with it are other kinds of anxiety disorders, mood disorders, substance issues, cardiac arrhythmias. A lot of times if people have an overactive thyroid, it can actually cause this. Asthma and irritable bowel syndrome. So, obviously if we were looking at rehabbing the brain for something like this, we would want to look at labs that are going to give us a lot of this information. All right, and when we have to differentially diagnose is congestive heart failure, asthma, epilepsy, alcohol withdrawal, hypertension, transient ischemic attack, and mitral valve prolapse, because these can look similar in various ways. So we have to be able to tell them apart so that we can make sure that it's specifically panic attacks that we're going after. So what happens with the neurobiology of a panic disorder? So the patient starts out by having fear. That activates the amygdala. The amygdala is part of your limbic lobe. And that activates the hypothalamus, which activates the adrenal cortex, which sends stress hormones into your bloodstream. And if those are at a high level that they can't be deactivated quickly enough, that's one way that you'll get a panic attack. You'll also end up pushing the fight and flight mechanism by also firing into the adrenal medulla. And again, if all these stress hormones, epinephrine and norepinephrine, these different kinds of catecholamines get released into the blood, and they don't break down fast enough. So they get released at a high rate, they don't break down fast enough, and this causes the panic disorder. So how can brain rehab help? Well, first of all, we want to look at labs. We want to make sure, what I would probably do is a 24-hour urinalysis, because we can look at adrenal hormones, and we can look at other aspects of hormones that could be involved theoretically here. Probably want to do also a thyroid, look at thyroid labs. And we also want to look at making sure that you don't have issues like blood sugar problems or an anemia or something like this that could prevent the brain from getting the vital nutrients that it needs to actually be able to improve and to have long-term change in the brain. So what we also do is we quantify the severity of the panic attacks. I'm using CNS vital signs. We can localize the areas of the brain that are either overactive or underactive utilizing a quantitative EEG. And then we can use neurofeedback to change those areas. So if an area is overactive, we try to lower that amount of stimulus to that area. So we try to lower the brainwave activity there, and then we try to raise the brainwave activity of the areas that are underactive. We try to give the appropriate supplements. So what you're also going to see with patients that have panic issues is that they usually don't have enough GABA, so that's a certain neurotransmitter. There's other neurotransmitters that may also be involved, and so we want to figure out which neurotransmitters are there not enough of in the brain biochemistry, and then we try to we give you special supplements that help your brain make those things. And we can also do special interactive somatic exercises that stimulate the brain. So there's special exercises that we can do to try to activate the areas of the brain that are underworking, and we can actually measure and graph out the improvement as a patient does these exercises, so we can make sure that we're going in the right direction with rehabbing the brain. Also, we give our patients exercises to balance out the two sides of the brain, and you do those, and then as you get better at doing one of those, then we give you another one, and we give you another one, and all these things exercise the brain and make the brain work a whole lot better. We're also, with any kind of mental health issue, we are willing to work with your other members of your healthcare team, especially counselors or mental health kinds of clinicians, psychotherapists and stuff, so that we can work synergistically on your behalf to give you the best kind of care. We also do pre and post testing to make sure that we're creating long-term changes in the brain. So I think that kind of sums it up. And so if you are interested in more information, or you want to set up an appointment, or if you have any questions, please feel free to contact us. This is our contact information. Have a great day, and check out our other lectures. All right.